brainstem is covered by cerebellum, posterior. You have brainstem here, and behind the brainstem you have cerebellum, and between the two is fourth ventricle. So where is fourth ventricle? Sandwich between brainstem anterior and cerebellum posterior. Fourth ventricle is sandwich between brainstem anterior and cerebellum posterior. Cerebellum is the roof and the brainstem is the floor of fourth ventricle. What are you looking at? Floor of fourth ventricle, but not anteriorly. This is anterior diagram and that is on the posterior side. So what you are looking at is anterior view. This is anterior view, but now what we are talking about is posterior view of brainstem. Say if this was brainstem, you are looking here now, and floor of what? Floor of this ventricle. What ventricle is that? Fourth ventricle. And what is the roof? Roof is cerebellum. Now, they are asking, in the fourth ventricle, there is hemorrhage. There is hemorrhage. Which artery aneurysm was ruptured? That is one question. I think it is there somewhere. So, they were asking that which of these arteries will rupture and put blood into fourth ventricle? There are two answers. See, one is the bestest here. You see this artery? This artery to cerebellum. What is this artery to cerebellum called on both sides? Pica. This is pica. What is pica? Posterior, inferior, cerebellar artery. This is the posterior, inferior cerebellar artery. It is supplying cerebellum, of course, and it also supplies this medulla. Which medulla? Lateral medulla. You block this artery with syndrome? Yes, lateral medullary syndrome or Wallenberg syndrome. You see, this is the pica. You block the pica and you will see lateral medulla suffering. And lateral medulla suffering means lateral medullary syndrome or Wallenberg syndrome. This artery bleeds into fourth ventricle sometime. So if there is some hemorrhage in fourth ventricle, they are asking which is the most common artery to bleed, and the answer was pica. Now, which is the other one? Is here. You see here. Where? Tip of basilar artery. Tip of basilar artery. At the tip of basilar artery, you can have aneurysms and they will bleed again into the fourth ventricle. Now this question becomes controversial. Why? Because they are asking which artery bleeds in fourth ventricle? Answer is pica. Answer is pica. But answer can also be the tip of the basilar artery aneurysm. Both are the answers. Now you also should know what is the incidence of aneurysm. Yeah. Because there are no other aneurysms rupturing so often. Because there are no other aneurysms rupturing so often. Bleeding is more because of pica and basilar artery. Otherwise you can say 10 arteries more. But the point is clinical finding. Clinically, incidence. That is what I am coming upon again. That okay, you are telling that pica is bleeding into fourth ventricle. Why don't the basilar artery? Then you have to know which of the two are having more chances of aneurysm. In that case, this is having more chances of aneurysm. You know, aneurysms are more common in circle of Willis. So it becomes a controversial question. The controversy is why the answer is pica. Why the answer is not the tip of basilar artery. There you see more aneurysms. That is a kind of a, you know, what you say, discussion which goes on in the journals. This is a journal-based question. These are journal-based questions. These AIIMS people, they keep asking journal-based questions. Investigators, they say this is the answer. Other investigators, they are telling that is the answer. And I am following the one which is a major group. So, otherwise, question is definitely controversial. So my answer remains pica. But if you don't have pica in the option, then your answer is tip of basilar artery. That is your second answer. See, these questions are controversial questions, and AIIMS people, they have this habit. They do this. No problem. Let them do it. We will give our best possible answer. Okay, what about question number 3 now? Question number 3 is asking about the cranial part of accessory nerve. You know, 11th nerve has 2 parts. 11th nerve has 2 parts. It is called cranial and spinal. So you say cranial accessory nerve and you say spinal accessory nerve. The cranial accessory nerve is supplying 3 muscles, 3 set of muscles. Which muscles it is supplying? The muscles of palate, pharynx and larynx. So what is the cranial accessory nerve doing? Cranial accessory nerve supply the muscles of palate, pharynx and larynx by the nucleus ambiguous. Nucleus ambiguous. So there is a nucleus ambiguous, and nucleus ambiguous has 3 nerves. Which 3 nerves you can show? Nerve number 9, 10, 11. It has nerve on 9, 10, 11. 11, which part of 11? Cranial part of 11. So this is the nucleus ambiguous. It has nerve number 9, 10, 11, and it has 11th nerve, cranial part. Now what is vagus accessory complex? This is vagus accessory complex. What is vagus accessory complex? It is actually 11th nerve do not go to the muscles. It doesn't go to the muscle. It will send the axons via 10th nerve, and then the muscles will be supplied. It is called hitchhiking. What is hitchhiking? Hitchhiking is you are going there, somebody will jump on your back and you will take him there and he will get down there. So somebody on the back is hitchhiking. You are just going there, so you are carrying the person, and there the person will jump down and you go your way and he will go his way. Point is, 11th nerve supplies, but it does not go itself to supply the muscles. What it will do? Send the axon into vagus. So those axons will hitchhike the vagus, hitchhiking vagus, and then get down where? Get down on the muscles and supply muscles. This is Gray's anatomy, and this is vagus accessory complex. So muscles of palate, pharynx, larynx are actually supplied by which nerve? 11th nerve. But then it is passing by the 10th nerve. And if you cut the 10th nerve, what will happen? Cut the 10th nerve branches, these muscles are paralyzed. Why? Because when you cut the branches of 10th nerve, you are actually cutting even the branches of 11th nerve. So you be careful. Now, is it applicable to all the palate, pharynx and larynx muscle? No. No. What about tensor palati? What about tensor palati? Tensor palati is supplied by which nerve? Mandibular nerve. So there will be some exceptions. What about the tensor palati? Is it supplied by vagus accessory complex? No. Tensor palati develop in first arch. When it is developing in first arch, which nerve is the nerve of first arch? Mandibular nerve. What about the pharynx? Pharynx, there is a muscle called stylopharyngeus. In the pharynx, there is a muscle called stylopharyngeus. Stylopharyngeus is an exception. It is not supplied by vagus accessory complex. It is supplied by 9th nerve. 9th nerve. So there is a muscle called stylopharyngeus. Stylopharyngeus is not supplied by vago accessory complex. It is actually supplied by 9th nerve. Similarly, larynx will also have some exception. There are some exceptions. You should know exceptions. Why? Because exceptions become questions. So that is the question here. You look at this question. This question is asking not supplied by cranial accessory nerve. What is your answer? Your answer is choice number A. Choice number A, because stylopharyngeus develop in third pharyngeal arch. The stylopharyngeus is developing in third pharyngeal arch and is supplied by a nerve called glossopharyngeal nerve. Glossopharyngeal nerve. Remaining muscles are muscles of pharynx. Remaining muscles are muscles of pharynx. Obviously, they are supplied by vagus, accessory, complex. Okay, what about the next question? 4. This is some histology question, and these people, they have this tendency of giving some controversial question all the time. Okay, no problem. Whatever. Yes? Sorry? You want that also? Then it's a big discussion. You want the big discussion? You have only 1.5 hours. Anyway, see, the point is arch number 1, 2, 3, 4 and 6, isn't it? Arch 1, 2, 3, 4, 6. You see, the 4th arch has muscles of palate pharynx, and 6th arch has muscles of larynx developing. Arch number 4, you have muscles of palate pharynx developing. Arch number 6, it is the larynx muscle developing. And then for the 4th arch, you have superior laryngeal nerve branch of vagus. For the 6th arch, you have recurrent laryngeal nerve branch of vagus. Now, you are talking about larynx. Larynx muscle should be supplied by which branch of vagus? All larynx muscle supplied by which branch of vagus? Recurrent laryngeal nerve, except the cricothyroid muscle. You are asking the exception. This is the exception. So cricothyroid muscle is the only muscle of larynx which is not supplied by recurrent laryngeal nerve. It is supplied by superior laryngeal nerve because it is the only larynx muscle which develop in 4th pharyngeal arch. You are asking about exception. So the exception is cricothyroid muscle is the only muscle of larynx not supplied by recurrent laryngeal nerve. Why? Because it doesn't develop in 6th arch. It is developing in 4th arch. So it is supplied by superior laryngeal nerve, branch of vagus. But obviously, vagus accessory complex. The arch 4 and 6 has vagus accessory complex. Arch 4 and 6. So arch 4 and 6, obviously they have vagus accessory complex. What about the arch 3? 9th nerve. What about second arch? 7th nerve. What about first arch? 5-3. What is 5-3? 5-3 is mandibular branch of trigeminal. Tensor palati here. Tensor palati here. What is this tensor palati? Why it is here? Because it is supplied, because this tensor palati develop in first arch. Who was supplying? Mandibular nerve. What about this stylopharyngeus muscle? What about stylopharyngeus? Stylopharyngeus is a muscle of pharynx, but developing in 3rd arch. So it was supplied by 9th nerve. You have seen all the 3 exceptions. Now, one exception is tensor palati. Other exception is stylopharyngeus. 3rd exception is cricothyroid muscle. 4th exception was palatoglossus. 4th exception was palatoglossus. What was the exception? Palatoglossus. Palatoglossus is a tongue muscle, but not supplied by 12th nerve. What is it supplied by? It is a muscle of palate also. Since it is a muscle of palate, it develops in which arch? Developing in 4th pharyngeal arch. And since it develops in 4th pharyngeal arch, the palatoglossus is the only tongue muscle supplied by vagus accessory complex. Vagus accessory complex supply the tongue muscle named palatoglossus. So remember 4 exceptions. They are the questions most of the time. Okay, now coming to question number 4. Question number 4, you are asked about some detail of mucosa. What is mucosa? Mucosa is 3 things. Mucosa is 3 things. What 3 things are there in mucosa? Epithelium, some connective tissue, and a muscle of mucosa. So this is mucosa now. What is mucosa? Intestinal mucosa. Let us say this is intestinal mucosa. So what is there in intestinal mucosa? 3 things. Epithelium, below that. Connective tissue called lamina propria, lamina propria. This is lamina propria. And what is still below? Muscle of mucosa. Muscle of mucosa. What do you call it as? Muscularish mucosa. This is MARD. What is MARD? MARD? All India PG question. MARD. What is this MARD? MARD is mucosa associated